First, they will discuss about two aspects in health diplomacy. So I cordially invite Dr. Lakshmi Somatunga, Additional Secretary, Public Health Service, Ministry of Health. So over to you, Madam.
Ayubowan. Good morning to all of you. Where's our Deputy Director General, Dr. Veeragama, and former DDGs, President College of Microbiologists, all the directors, young administrators, Professor Sanjoy, ladies and gentlemen. I have a very pleasing task of talking about this very important subject. So at the outset, I want to thank all the organizers for selecting this important topic, particularly WHO Collaborative Center at all. The concept, first let us look the concept. Actually, what is health diplomacy? Practice by which governments and non-state actors attempt to coordinate global policy solution to improve global health. Very much relevant to us, all of us. This brings together the disciplines of public health, international affairs, foreign affairs, management, law and economics, and focuses on negotiations that shape and manage the global policy environment for health. Policies are there. If those are not shaped and managed, the purpose is lost. And this results in improved global health, greater equity, better relations and trust between states, and strengthen commitment to improve health nationally and globally, especially even the political commitment, which is a blessing and a must. What I can give the best examples in Sri Lankan context is related to tobacco control. Why this has a relevance and why the diplomacy was really needed? Because it's a risk factor for many diseases and it has different components. Maybe sponsorship, maybe use, maybe advertisement, maybe sales, so different components. And commercial product, unfortunately registered products in Sri Lanka since 1936 and goes beyond the area of particular subject. It really goes beyond the limits, boundaries of health sector. Although we lead, we must lead, but a lot of stakeholders are there and requires multiple response because we are dealing with a very strong vector which transmits and directly affects socio-economic status. We'll look at the application of diplomacy here. Sri Lanka participated in all the intergovernmental negotiation sessions for a treaty. Individual countries could not comprehensively control tobacco to certain extent we can. But as lot of cross-border issues, so we really needed the partnership by all. And we were, Sri Lanka were a strong supporter while the negotiations were going on since 2000 until 2003, very big tedious process, and supported by majority INGOs and civil societies. Otherwise we could not do. And finally, Framework Convention on Tobacco Control was born, the first ever public health treaty. And what was the ratification process? Lot of diplomacy. Seeking cabinet approval. It's not only health, so finance, trade, so all the ministers should agree. And because there were a lot of opinion, because of tax incurred due to tobacco, And signing the FCTC, we signed on 23rd of September, and then we prepare for signing, and then you need to really look at the laws and regulation, whether it's enough, at least basic. There was a pre-requirements, there were requirements in order to go for ratification, basic laws, but we had regulations, but in different ministries and departments. But that was a requirement, at least to have basic law, and we prepared and deposited the instrument of ratification. I recall the support given by the Foreign Affairs Ministry that time, and I was the Director on Communicable Diseases then, and my good friend Neelamani is here. I know he's coming from Uber. Always we had a very good relationship with every province, and when this actually the anti-tobacco day, World No Tobacco Day, is celebrated, all the PDs, all the RDs gave a fullest support, and lot of advocacy was made. Every year there was a dedicated theme, and we worked on that, and it was a year-long sustainable activity, and with lot of civil societies, and I cannot forget the role played by media, because when you talk about diplomacy with the government, non-state stakeholders are very important. So the role played by media was really important, and really it was useful in order to come to this status in this country. And finally, instrument of ratification was transmitted to the Secretary General of United Nations on 11th November 2003. And very proudly I mentioned that Sri Lanka was first country in Asia to ratify this public health treaty, and fourth in the world. So we were able to really declare our statement at very high fora. And just because of we were a party, and we were among first 40 countries, and this was really instrumental in order to pass the law, which could not happen for 6.5 years. We were able to do when it is led by Health Ministry, and irrespective of the political party, all supported at the Parliament, and it was a historic event. So that is the partnership. So we were able to pass the law, and then National Authority on Tobacco and Alcohol was formulated. And although we had many legal challenges, they filed cases twice, and we won because of the support given by many stakeholders. I took that example because it's a very good one, and even in the world, at the global level, these treaties have been mentioned as a good example for health diplomacy, because which we could not do alone, we could do because of this. So to mention other examples, actually, this is called international bilateral and multilateral negotiations. Lot of trade negotiations are there. ILO is leading these, for health, WHO, the Trade and Commerce, ILO, International Labour Organization, lead and guide the countries, and intellectual property rights and access to medicine. In the previous seminar, I raised the question because I know that if we are a party, and if we could bring changes in our regulations, we could do better. You know, we will be able to access better medicine, all the medicine, not only antibiotics, at appropriate rate, competitive rate, but also very effective ones. So these are some examples, and there are partnership lot of programs like Global Fund to Fight AIDS, TB and Malaria. It is in operation in Sri Lanka, so it's another example for health diplomacy. And in 2012, London Summit for Family Planning is another excellent example for this type of diplomacy. And actually, I was supposed to go to another very historic summit next week, but it has been postponed. That's Healthy City program. We were able to enroll Colombo City, because only city which is qualified to be enrolled in this summit, I mean this partnership for healthy cities governed by Bloomberg Philanthropies, is Colombo, because in order to qualify you must have a population more than 1 million. So that is the only city in Sri Lanka where you can get more than 1 million. So, so we are going to enroll. So it will be another event, and one day it will be a good example for diplomacy, because a lot of non-state actors should be there, not only the government. And we have chosen, like here last summit for family planning, this time Colombo is going for healthy eating, which is a very essential thing in order to combat this 72% of burden of non-communicable diseases. So our mayor selected this topic, and out of 11 themes given. So we are for any topics, but we are also happy that with applying these principles of diplomacy, we have a lot of activities ahead of us. We know that we will be able to make at least one step further than the situation today, to make the food pattern, diet healthier than today, and keeping in mind giving some priority to traditions also. What are the advantages of going along with health diplomacy? Make difficult things possible. Things are difficult, but not impossible. So by applying this, we can have very comprehensive, organized and proactive policies done, and comprehensive, effective and responsibility will be shared. And at the same manner, I want to say the we feeling is very important in order to have a good result, so and yield good results. With this, I want to say thank you. Before concluding, I want to recall my training at Graduate Institute in Geneva, Switzerland, which really created good insight in me towards this subject. And we hope that at least a batch of our administrators will have an opportunity to have the same kind of training one day. So thank you very much.